The Democratic Republic of Congo in Africa is facing a new health challenge, Mpox. This viral disease has re-emerged, causing significant concern among health officials and the general population. This isn't the first time Mpox has appeared in Africa. Historically, the continent has battled this disease multiple times, each outbreak leaving a mark on the healthcare system. But the recent surge in cases is particularly concerning. Hospitals are becoming overcrowded, and healthcare workers are stretched thin, trying to manage the influx of patients. Mpox is a viral disease, and it can spread quickly from person to person. The virus is highly contagious, making it a formidable opponent for health authorities. Health officials are working hard to contain the outbreak. They are implementing various strategies, from vaccination campaigns to public awareness programs, to curb the spread. But it's a reminder that infectious diseases remain a serious threat. The need for vigilance and preparedness in the face of such outbreaks cannot be overstated. The situation in the DRC serves as a warning, reminding us that diseases don't respect borders. It underscores the importance of international cooperation and robust healthcare systems to tackle such global health challenges effectively.
Mpox often starts with flu-like symptoms, fever, headache, and muscle aches. These initial signs can be quite similar to other common illnesses, making it difficult to identify at first. It's important to monitor these symptoms closely. Swollen lymph nodes are a distinctive sign of Mpox. This swelling typically occurs in the neck, armpits, or groin and can be quite painful. It's a key indicator that differentiates Mpox from other viral infections. A rash usually follows, developing into fluid-filled blisters. These blisters can appear anywhere on the body, including the face, hands, and feet. The rash can be itchy and uncomfortable, often leading to scratching and potential secondary infections. These blisters eventually scab over and heal. The healing process can take several weeks, and it's crucial to avoid picking at the scabs to prevent scarring and further infection. Mpox spreads through close contact with an infected person or animal. This includes direct skin-to-skin contact as well as respiratory droplets from coughing or sneezing. It's essential to maintain good hygiene and avoid close contact with infected individuals. Contact with contaminated materials like bedding can also spread the virus. It's important to regularly clean and disinfect surfaces and objects that may have come into contact with an infected person to reduce the risk of transmission. Most people recover from Mpox within a few weeks, but it can be severe, especially in young children or people with weakened immune systems. In these cases, medical intervention may be necessary to manage symptoms and prevent complications. Early detection and treatment are key to a successful recovery.
The recent Mpox outbreak in Africa, particularly in the DRC, has raised global concern. The World Health Organization has declared it a public health emergency of international concern. This declaration is a call to action for all countries to strengthen their preparedness and response efforts. The WHO is working closely with affected nations to provide support and guidance. International collaboration is crucial to controlling the outbreak and preventing further spread.
Section 4 Mpox in East Africa, a looming crisis. The Mpox outbreak is not limited to the Democratic Republic of Congo. It has now spread beyond its borders, causing alarm across the region. Neighboring countries like Rwanda, Uganda, and Kenya are also reporting cases. The situation is becoming increasingly dire as more people fall ill. The virus is spreading rapidly in these regions, putting a strain on healthcare systems. Hospitals are overwhelmed and resources are running thin.
Adding to the concern is the emergence of new virus variants. These variants are complicating efforts to control the outbreak. These variants might be more transmissible or cause more severe illness. This has led to increased vigilance and urgency among health officials. Scientists are studying these variants closely to understand their potential impact. They are working tirelessly to develop effective treatments and vaccines to combat the evolving threat.
Section 5 India's proactive response, shielding a nation. While Mpox cases are currently low in India, the government is taking proactive measures to prevent a large outbreak. Surveillance at airports and seaports has been heightened to identify potential cases early on.
Hospitals are being equipped and prepared to manage Mpox patients effectively. India is also at the forefront of vaccine development for Mpox. Researchers are working tirelessly to develop safe and effective vaccines to protect the population.
Section 6 vigilance is key protecting ourselves and others. The current risk of a large Mpox outbreak in India is low. However, continued vigilance is crucial. We must remain informed about the disease, its symptoms, and how it spreads.
Practicing good hygiene, such as frequent hand washing, is essential. If you experience any symptoms of Mpox, seek medical attention immediately. By staying informed and taking necessary precautions, we can protect ourselves, our families, and our communities.